Hello friends, we are starting with a new chapter that is Healthcare of Community, and today we are learning about ASHA. Now this lecture is extremely important as many questions are asked from this topic. So I will be discussing about who is ASHA, who appoints her, what is the selection criteria, to whom she reports, and very important what her roles and responsibilities are. So ASHA is an example of community participation. This means that there is active involvement of people in providing the primary health care. People are involved in planning, implementation and maintenance of health services, so which helps to promote social awareness and self-reliance on the community. So with this, let us start with the video. The full form of ASHA is Accredited Social Health Activist. ASHA is a trained female community health worker working for a population of 1000 in rural areas. She works for promoting mother and child health care services. So ASHA is selected by the Village Health and Sanitation Committee and she reports to the Gram Panchayat. The selection criteria is a married female in the age group 25 to 45 years must be a primary resident of village, educated up to class 8 with good communication and leadership qualities. The induction training of ASHA will be of 23 days in all, spread up to 12 months. On-job training would continue throughout the year. So now let's see what are the roles and responsibilities. So ASHA will work with the Village Health, Nutrition and Sanitation Committee to develop a comprehensive village health plan. Along with this, she also promotes ANC and PNC by motivating all the pregnant women to undergo at least 3 antenatal checkups, escorting the pregnant women for institutional deliveries, ensuring that the women who deliver at home receive postnatal care and also counsel on birth preparedness. She also promotes breastfeeding and immunization by educating the mother on importance of breastfeeding, the duration of breastfeeding, correct positioning and complementary feeding. She motivates the mother to get her children immunized. Plus, she promotes adolescent reproductive and sexual health among the adolescent girls, as well as she promotes family planning by motivating the couple to use family planning method and adopt small family norm, provide free contraceptives, for example, oral pills. Not only that, she also provides primary medical care for minor ailments such as diarrhea, fever, and also give first aid. She facilitates in accessing the healthcare services available at Anganwadi, Subcenter, PHC provided by the government, accompanies the pregnant women and the children. She carries a drug kit and she is a depot holder for ORS, iron folic acid, disposable delivery kits, oral pills, chloroquine tablets, so that they are readily available to the community. She reports all the vital events like birth and death to the subcenter or PHC, report any unusual health event, and also create awareness in the community regarding personal and environmental hygiene, promote the use of sanitary latrines and safe drinking water, nutrition, diseases commonly seen, and healthcare services. So let me know your answer below. If you found this video helpful, like the video, share it with others and subscribe for more.